Okay. Hi, so you're Joyce?
Yes, I am.
Hi, Joyce. My name is Jessica. I'm a student pharmacist at Drake University. Looks like we're going to talk about a new medication that you're starting today. Does that sound right?
Yes.
Awesome. So the medication they're going to start for you today is called Invokana. What did your doctor tell you about that medication?
It's for the diabetes.
For the diabetes.
Blood pressure. Blood sugar.
Blood sugar. Okay, yeah. That is definitely a medication that we usually see added on to regimens for helping with blood sugar control, so to control diabetes. It looks like on your profile you also fill metformin with us, and that you also use that for your diabetes.
Yes.
Is that correct? Awesome. So the metformin, it looks like you take twice a day. Do you take that with your meals?
I take it at breakfast with my other meds.
Okay. And then do you take the metformin in the evening as well?
Yes.
Okay, great. So the Invokana is something that you're actually just going to take once a day.
Okay.
So I would suggest really whatever time of the day you think you'll remember to take it, go ahead and take it then. So like you said with your metformin, you're taking it with your other medications, so presumably you take those other ones in the morning.
Yes.
Do you think that'll be best for you to take the Invokana?
That would probably work.
Great. Do you usually feel about taking your medications? Are you pretty good about it? How many doses would you say that you miss?
I'm very regular.
Very regular. Great. With the Invokana, as with most medications that we use chronically, it's just very important to keep up on, on taking it every day. If you would forget to take a dose, never double up on your doses. If, say you remember the next day. If you were to remember later in the same day, say by, we usually say halfway until the next time you would take it. So even by dinner time of that day that you missed in the morning, go ahead and take it. If not, just skip and move on to the next day. So like I said, the Invokana for controlling your diabetes, looks like Dr. Nathanson wrote for a prescription of 30, and they also put 3 refills on it.
Okay.
Do you have a follow-up appointment with the doctor?
In a couple of months.
In a couple of months? Awesome. Just check in and see how things are going. So, like I said, with the refills, whenever you're getting near being out, go ahead and let us know and we can refill that for you.
Okay.
And then you'll probably check back with the doctor, I think, before you need a new prescription anyways, or else we can always be in contact with him as well. So as far as what to expect with Invokana, did the doctor talk to you about that at all?
Not in detail. I'll let you explain that to me.
Yeah. So the Invokana is actually going to work by helping your body get rid of the sugars like in the urine. So basically, like I said, that's the way it's going to work. So it's going to work kind of like more down in the kidneys. And so some things that you may expect with that, hopefully, again, we're going to see lowered blood sugars in conjunction with the metformin, going to lower your blood sugars and overall help lower your A1C. And then as far as side effects go, just knowing that it could cause you could notice a little bit of excess urination. There are risks of urinary tract infections in addition to that because with more sugar in the urine.
Mm-hmm.
So if you were to notice any symptoms such as increase in urinary frequency, or pain while urinating, just make sure you let your doctor know and they'll proceed and probably go from there. That makes sense. Otherwise, it doesn't tend to cause a whole lot of hypoglycemia or like lowering of your blood sugar too much, so you shouldn't notice hopefully like any symptoms of hypoglycemia or dizziness or anything like that from that. Does that make sense?
Mm-hmm.
Awesome. So as far as with your other medications, it doesn't look like I said, that there's any interactions as well. So that's a good thing to watch out for. Do you drink alcohol at all?
I have a couple of glasses of wine with dinner usually.
Okay. Just being aware that that could kind of mess with your blood sugars as well. A little bit can make them go up or down, and so being aware with, especially adding on a new medication, the signs of hypoglycemia, so things like dizziness. And do you check your blood sugar every day as well?
Mostly I wait until I'm at the doctor's office.
Okay. I would recommend if you can get in contact with your doctor, trying to do more regular blood sugar checks at home as well. What questions do you have for me that I can answer?
What is the difference between this diabetes med and the one I already take? Do they work?
Yeah.
They work differently?
Yeah. So
Oh,
let's
okay.
hands up.
Okay.
Awesome.
Okay. Well, I got a lot of information.